Okay, a common topic that comes up is knowing the difference between an annual wellness exam and a physical when you're first getting onto original Medicare. So here's some key points to take into consideration. Within the first 12 months, when you're new to Medicare, you're going to get a one-time welcome to Medicare um, annual wellness visit. So the annual wellness visit is different than an annual physical. And sometimes people are confused by this. They might get a physical, get a bill, not know why they're getting a bill. So basically what the annual wellness visit is most of the things that you get in the physical, but it doesn't include the labs and the imaging or the actual physical exam, right? So it does, they focus mainly on prevention and planning, whereas an annual physical will focus on diagnosis and treatment. So under Medicare Part B, the annual physical is not covered. The annual wellness visit is covered, right? And that's covered every 12 months. Okay. Now, if you get secondary coverage to Medicare or you get a plan that replaces Medicare as primary payer, then there are ways that that physical can be covered, which would include the lab work. But original Medicare Part B by itself doesn't necessarily cover that annual physical. So some other things to keep in mind, like preventative visits. Like what are preventative visits that are covered by original Medicare that are covered by Part B, right? So we touched on one, the annual wellness visit. Cancer screenings, like so the bone mass measurements, flu vaccines, hepatitis, RSV, all those types of vaccines are covered under Part B at no cost. If you go to a Medicare participating provider. So labs and health screenings like cholesterol screenings, diabetes screenings, screenings for hepatitis or HIV, those are covered at no cost regularly. There are certain frequency limits that you have to keep in mind, but there's no cost unless there's diagnostic workup that occurs, right? So like that means like you go for something preventative and then the doctor says, well, I also want to check this because of something that you mentioned. Or a common example is, women go for a mammogram. Then the doctor says, okay, I want you to come back 3 months later so we can do another image because maybe they have dense tissue or something like that. So that second visit wouldn't be considered preventative. It's not that it's not covered. It just wouldn't be considered preventative. So meaning it may be subject to a deductible. So other services covered by original Medicare would be things like behavioral and lifestyle support screenings, which are like tobacco cessation programs, alcohol misuse counseling, or obesity counseling. Okay. Then, if we go down to like nutrition, chronic disease services, those were things like diabetes, self-management, like training, right? Like how to use lancets, how to use the needles. Medical nutrition therapy. Okay, those can be deemed covered when medically necessary. Okay, and then some services could also be subject to a deductible or co-insurance under Medicare Part B. Okay, so I'll pull up some key differences here. Okay, so again, covered by Medicare Part B, your annual wellness visit, yes, the annual physical, and again, the distinction on the focus. Mainly the easiest way to think about it is the labs, right? So an annual physical includes the labs. The annual wellness visit does not include the labs, right? And the physical exam is like, getting looked over basically. The annual wellness visit does cover those cognitive and depression screenings. And again, that's every year as well. Okay. So, some other things to also, keep in mind when you're looking at Medicare preventative services. We talked about the behavioral and lifestyle support, lab and health screenings, HIV prevention. It covers medications, counseling, hepatitis screenings at those for those that are deemed at risk. And then as long as you go to an in-network provider, there's not going to be a cost for those preventative measures for that certain subject. There's some interesting distinctions too between men and women to keep in mind as well. And some of those have to do with the heart screenings. So an example to keep in mind, just as a caveat to some of these screenings we mentioned, is the abdominal aortic aneurysm screenings. So Medicare will cover this if somebody's deemed at risk and they meet certain qualifications. So if they're between ages 65 to 75, they've smoked at least 100 cigarettes, and they are a male. So those are some kind of, deep in the weeds limitations. Like, it doesn't cover it if you've smoked less than that. If you're a female, then it's not covered as a preventative service, right? Doesn't mean that it's not covered. It's just not covered as a preventative measure. So there's Medicare has a publication that we'll drop in the description here. They have a quick PDF on these things that they do cover. So I'll put a link to that. The bone mass measurement, this cardiovascular behavioral therapy, the cardiovascular disease screenings, again, with that distinction that we just mentioned. The mammograms, lung cancer screening. So there's a whole list that we'll drop in the description of the video as well. So if you thought this was helpful, you want to check out more videos on Medicare, this next one right here, this would be a good place to start.